Assalamu alaikum. Now I would like to discuss about the prenatal testing and screening. This is the most important topic of obstetrics taken from the USMLE inner circle. Okay, I will make you see a video. Can you tell me the diagnosis? Look at the stain this baby's throat. Looks like port wine stain. Okay, we know that where we can get the port wine stain. Trump track calcification. It is unilateral. There may be mental retardation, possibly in the gene. Can you guess the diagnosis? This is Starch Weber syndrome. In Starch Weber syndrome, there is port wine stain, Trump track calcification. It is unilateral mental retardation, gene. There may be epilepsy. Okay, now start with this bang. Routine prenatal lab tests. Before remembering these tough things, start with start from here. This part actually most important, and most of the question comes from these 24 to 28 weeks. In 24 to 28 weeks, what should be done? Hemoglobin and hematocrit, 1 hour 50-gram glucose challenge test, and antibody screen if Rh negative. Antibody screen if Rh negative. In 36 to 38 weeks, Group B Streptococcus rectovaginal culture. Group B Streptococcus rectovaginal culture. And for initial prenatal visit, Rh type and antibody screen, hemoglobin, hematocrit, MCV, ferritin, HIV, VDRL, HBs, HE, anti-HCV, rubella, varicella immunity, urine culture, urine dipstick for protein, chlamydia, PCR, and pap test. And 50-gram 1 hour GCT for diagnosis the gestational diabetes mellitus, and 100-gram 3 hour OGT to confirm the diagnosis. If 50-gram 1 hour GCT is abnormal, you should do 100-gram 3 hour OGT. An indirect antiglobulin or Coombs test can be used to determine whether Rh negative patient has developed anti-Rh antibody and is important component of early prenatal care. An indirect antiglobulin Coombs test can be used to determine whether Rh negative protein has developed anti-Rh antibody and is important component of an early prenatal care, especially in patients with previous pregnancy. Prenatal visits are recommended every 4 weeks until 28 weeks. Prenatal visits are recommended every 4 weeks until 28 weeks of gestation, every 2 weeks up to 28 to 36 weeks of gestation, then every week until delivery. High risk sexually transmitted screening in pregnancy. High risk sexually transmitted screening in pregnancy. High risk patient age less than 25, prior STD. High risk sexual activity. Age less than 25, prior STD and high risk sexual activity. Multiple partners, commercial sexual work, and whether the required screening performed at initial visit and at third trimester, preformed at initial visit and at third trimester. HIV, syphilis, hepatitis B, C, gonorrhea, chlamydia. HIV, syphilis, hepatitis B, C, gonorrhea, chlamydia. In negative chlamydia trachomatis, nucleic acid amplification test at the initial prenatal visit, followed by a positive test in the third trimester, most likely indicates a newly acquired infection during pregnancy. Patients treated for sexually transmitted infection during pregnancy require retesting a month after completion of treatment to ensure response to therapy. Test of cure. Patients with sexually transmitted infection diagnosed earlier during pregnancy and retested in the third trimester. First trimester in 9 to 13 weeks. First trimester in 9 to 13 weeks. Early testing. Disadvantage: it is not diagnostic. Early first trimester combined test. Pregnancy associated plasma protein beta hCG and nuchal translucency. Cell-free fetal DNA more than 10 weeks. High sensitivity and specificity for cell-free fetal DNA for high sensitivity and specificity for aneuploidy. It is disadvantage, not diagnostic. And chorionic villi sampling definitive karyotype diagnosis, invasive and the risk of spontaneous abortion. Second trimester quadruple skin on 15 to 22 weeks, screen for neural tube defect and aneuploidy. And amniocentesis 15 to 20 weeks, definitive karyotype diagnosis. And second trimester ultrasound 18 to 20, measure fetal growth, evaluates fetal anatomy and confirms placental positioning. What is cell-free DNA testing? Cell-free DNA testing indicated test at 10 weeks of gestation onwards, identify for chromosomal aberration. Identifying for chromosomal aberration, high specificity and sensitivity for aneuploid is not diagnostic, must confirm with CVS or amniocentesis. Cell-free fetal DNA testing is done if maternal age is more than 35. Abnormal maternal serum screening test. Abnormal maternal serum screening test. Sonographic finding associated with fetal aneuploidy. Sonographic finding associated with fetal aneuploidy. Previous pregnancy with fetal aneuploidy. Parenteral balanced Robertsonian translocation screening. Cell-free fetal DNA screening for trisomies 21, 18, 13, and 6 chromosomal aneuploidies and fetal sex determination. Fetal sex determination is done by cell-free fetal DNA testing. Cell-free fetal DNA testing, fetal sex determination, and screening for 13, 18, 21, and 6 chromosomal aneuploidy. First trimester screening 21, 18, and 13. That means cell-free fetal DNA testing. In 21, Down syndrome. We know that Down syndrome is high up, hCG and inhibitin up, and the papa is low in everywhere. And in 1813, beta hCG is low. And for 13 everything is absent, and for 18 everything is low. Beta hCG, inhibin A, estriol, and alpha fetoprotein all are low in 18 but high up. Cell free fetal DNA testing is used to screen heritable disorder like cystic fibrosis, Tay-Sachs disease, and spinal muscular atrophy. Cell-free fetal DNA testing. What is the next step in the management for a pregnant woman at 12 weeks of gestation? Abnormally elevated beta HCG, abnormally elevated beta HCG, and increased nuchal thickness. If there is increased nuchal thickness, and abnormally elevated beta HCG, you should do CVS, chorionic villus sampling. Chorionic villus sampling. And this chorionic villus sampling, this patient has positive trimester. This patient has a positive first trimester combined test. The diagnosis made via CVS or amniocentesis depending on the age. Okay, that's all about cell-free fetal DNA testing and the prenatal testing and routine prenatal lab tests. Okay, hope you enjoyed.